I'm Mark Hennick. This is So-Called Normal. For those who live with mental health issues, one of the qualities necessary in getting well is having persistence. It's needed as patients navigate these three very important and necessary steps. First, coming to the realization that something is wrong. Second, there's the sometimes frustrating process of finding what works to fix the problem. And third, developing the tools to know how to deal with the setbacks when they occur, because they will, and they do. That's just part of the long journey those living with mental illness travel. And throughout it all, there's a stigma that many feel about being labeled or having a sense of shame. It's real in 2020, because although progress has been made, there's still a long way to go. Natasha's here to share her story.
Well, Mark, thank you for inviting me. I think the reason I am willing to talk to you and I am talking about it, I think it's an important story in that people hide their depression. People hide their mental illness because they're ashamed of it. And part of what I did and part of why I've went through so much of it is I didn't share it with friends or colleagues, and I just suffered in silence. So my story basically is I've had depression my whole life, or I've had episodes of depression my whole life. I was not diagnosed through several of them because I either didn't realize that I was sick, which looking back and hindsight is 2020, and looking back in my life, I could see that I've had I've had a number of periods of deep darkness that I never talked about. I never I never sought help for. And I think looking for help when one is feeling so low, so dark, and one is considering suicide, that is a very serious thing. So my first episode that I remember, I was 14, and there was a suicide attempt. And I was diagnosed with depression and with some kind of other physical issues. That I was not put on any kind of medication other than for the physical issues. There was no antidepressants. There was nothing of that sort. That resolved itself, I think, when I started, when I became an older teenager. And I ended up going to university, and I got married at 19, university at 17. And it was I was triggered there at that time. Looking back, I know that I was in a deep hole. I was sleeping. I had, worthlessness. I didn't attend classes, anxiety. I was not in any way diagnosed because I didn't look for help. I didn't realize. It's just looking back at it now, from the vantage point of my more mature years, I can see that I was quite sick. I was sick for a number of years at that time.
What was going on in your life back at that first diagnosis or that first experience of crisis? What did your life look like then at home and at school?
I was 14. I was in grade 9, and I had no self-esteem whatsoever. I just felt horrible. I just hated myself. I think part of it was just the normal teenage angst, but through therapy now that I've gone through in the last number of years, through very intensive therapy, I've realized that a lot of my childhood has triggered a lot of the episodes that I have had. It was my upbringing. It was, my mother was a very loving woman, but she had PTSD because she had gone through, World War II. And it's only now that I realized that she had PTSD. So when I was diagnosed with it, I could I realized the symptoms, and I could see that she had it. And so with PTSD, she had very little emotional control. And so she was extremely volatile. And as was the norm in Eastern European countries, if your child is misbehaving, you hit the child. So that norm hopefully is changing. But at the time when I was small, I was hit a lot. I was physically abused. So that triggered a lot into my future life.
Sure.
So, and emotional abuse as well. You know, when you're being hit, you're being shamed, you're being told you're worthless. You know, how dare you? You're a bad person. You're a bad child. And so that just locks itself into your soul, into your psyche. And so you're carrying that. And so I think when I became 14, or I turned 14, 13, 14, you know, becoming a teenager, the hormones, you know, going into, you know, getting into high school, I think that was just everything just triggered. And I just landed, you know, where I just didn't want to live anymore. And I took a bunch of pills that I had been prescribed for these physical symptoms that I was having. I was fainting everywhere all the time. I just got sick after that.
We talked about the stigma that goes along with the difficulty of living with a mental illness. Dr. Christina Iglesias has made it her focus to dispel and tear down the labels that come with depression. She's a licensed clinical psychologist. And in addition to her busy practice, she's also the founder of the #TherapyIsCool mental health action campaign. In short, it aims to raise awareness around mental health, and it donates all proceeds to a variety of mental health organizations to help support making therapeutic services more accessible. She joins us from her home city of San Francisco.
My hope is that people are continuing to stay up in the scientific world of what treatments are working or are more optimal for specific mental health issues versus many of us who just rely on the trial and error approach, right? I think it's our job as clinicians to continue to be advocating for enough modalities where people can come into our office and say, hey, I'm struggling with depression, and we have 2 or 3 techniques, interventions, tools that right off the bat that person can feel relief from. I think that many professionals and providers stick to a very standardized regimen that might work for some people, but are going to be a miss for many people. And so until us as providers take initiative to figuring out what's going on in the medical world, what's going on in the therapy world, and how can we implement that with the people we work with, people are going to continue to show up to providers that are just going to write them the same prescription that they write everyone they see and hope that it works for them.
Why is the system, in your view, so disorganized? Is it a matter of so many really smart, or too many really smart people in the same rooms? Is it a matter of stigma? Why is it such a mess?
I think that there are so many layers. One being, until we as a society view mental health on the same playing field as physical health, it will not get the funding. There's not funding in mental health research. There's not funding in mental health care. Wouldn't it be amazing if there was something called preventative mental health care? I seem to find it for physical health, right? We can go to our doctor every 6 months and get a checkup. Where is that for our mental health? We can go to the dentist every 6 months and get a cleaning, right? That's preventative for our dental care. Where is that for our mental health? In 2020, we still do not prioritize, amplify, care about mental health in any way, shape, or form on the same playing field as physical health. And until that changes, people will continue to get sick, people will continue to suffer in silence, and people will continue to die because they won't have access to the treatment modalities that they need.
You know, it's interesting to hear you speak, because I think that this is a stigma in some ways that exists within the mental health community as well, a community that I've never known any other community. It's the only community I've ever been a part of. I tell people all the time I have no other transferable skills. This is all I do. So
don't ask me to change careers.
Well, exactly. It's like I'm no rocket scientist. I only do this. But the reason why I say that, though, I think because for some of us who have been involved with or watching the mental health movement for a long time, we're able to identify sometimes unhelpful streams or stigmas within us ourselves or within the space itself. And one of those, for me, seems to be while the wellness industry is a multi-billion-dollar industry, it's often criticized for such. Wellness is often seen as less than or dismissed as fluffy. But in many ways, what you're talking about, or many of the things that fall into that wellness category, are preventative mental health care interventions. They're things that are subclinical, but that help people to feel good about themselves. So what's your view on the wellness movement, the wellness industry, and how we treat that?
Yeah, I choose not to view the wellness industry as all good or all bad, because I think that if you're in the mental health field, you have to be looking at things through the lens of how does this support somebody who potentially is either prone to mental health issues or is experiencing mental health issues. I think that wellness entails this ability for us to be physically, mentally, and emotionally within a baseline where we can be productive humans in the world. And for many people, they are unable to access wellness because of their illness. So they view the wellness industry, right? The clean eating, the yoga retreats, the, meditation compounds as things that they can't have access to because of where they are at. Other people can enter the wellness arena and know that there are things out there that absolutely could be helpful for their mental health. So, any kind of movement or exercise, we already know is a benefit to your mental health. Any awareness around nutrition and how you fuel your body, we already know impacts your mental health, right? Mindfulness and meditative practices absolutely can be part of a treatment plan. So we can't view the wellness as all good or all bad. It just is about how can we actually make it more accessible to everybody? Because I think what we do know is because it's $1 billion industry, you have to have money to be able to enter it. And that unfortunately even goes for mental health care, that at this time, you still need to have some kind of financial flexibility to pay for a therapist, to pay for, a Pilates class. These things are not available or accessible to the general public.
Tell me more about those systemic barriers to mental health, because that's really what we're talking about here, right? If you're unemployed or homeless, homelessness isn't a mental illness. Being unemployed isn't a mental illness, but we certainly see higher rates of diagnoses in marginalized communities, BIPOC communities, in all LGBTQ communities. So talk to me a bit more about these barriers. What are the systemic barriers to recovery?
I think that they are everywhere. We don't want to see it, right? They're within our communities. They're within our healthcare systems. They're within our education systems. We have barriers everywhere we look, and that is why dismantling them is so incredibly important. In the mental health world, the barriers come straight from when you enter the world. Are you getting medical care? Right? If your mother didn't get medical care when she was pregnant with you, what does that mean for you when you come into this world? What does it mean if your parent or parents have a mental health issue that they could never get access to care? How would that implement and affect your childhood, right? I mean, these things are just the basic needs of, are we even able to get medical care for people? Are we even able to have food on the table so people can have an opportunity, a minute, a second to think about their mental health. When you're in survival mode, you're not prioritizing your mental health, because guess what? You have to survive. And until we can break down the barriers that are causing people to have to be in survival mode, we're going to continue to see the same patterns of people with depression, anxiety, PTSD, and a whole myriad of mental health issues that potentially, if these barriers were broken down and treatment was accessible, wouldn't be there or wouldn't be as debilitating as they are in our society.
Access to treatment is an important issue, but what if that treatment is refused? Natasha says she stopped her treatment in her teens. She went through years of trying to cope with undiagnosed depression and PTSD.
Well, I stopped being treated for depression. I think I was about 15 or 16 at the time. Mm-hmm. And so I didn't have any kind of treatment throughout when I was in college or married when I had that episode. There was no treatment because I wasn't seeking treatment. I didn't realize I was depressed. I didn't know what was going on. I was just existing. And that's, I think, one of the key things is that most people don't realize that they, what they're feeling off, that things aren't right, that you're not happy, that everything is sad, the world is gray, you just want to sleep, or you just want to eat, or you just want to be away from people, that these are symptoms. These are symptoms that there's something wrong something's going on with you, and you need to have this looked at. If you're off your norm, your baseline, and you're feeling low, you should be talking to, having conversations with your doctor. That's what was happening to me. I was sick. I was quite sick. I spent days in bed. But looking now, I see it. At that time, my husband said I was just being lazy.
Right.
I didn't go to class. I cut classes because I just couldn't. I just couldn't face being in class. I didn't do assignments. It was my first year at university. My first 2 years were absolutely terrible.
Yeah. Yeah. Do you think people around you noticed and didn't know what to say, or they just didn't notice?
I don't think they noticed. They just, as I said, my husband said I was lazy.
Right.
It's because he was one of these high energy people, and I was not at the time. And and I wasn't being lazy. I just couldn't get out of bed.
Right.
And that's, I think, part of the stigma of everybody who is suffering from depression. That, people think, you're lazy, get with the program, what's wrong with you? Just pull yourself up with your bootstraps, all that kind of stuff. And that's the thing that kills people, is that misunderstanding of what mental illness is, of what depression is, what PTSD is, anxiety.
Yeah, I've often felt that's really, we try to recover in a system that really doesn't make recovery very easy, but then it compounds the difficulty even further when some of the core symptoms of the things that we need help for in the first place are symptoms that prevent us from getting help. They keep us inside. They make us scared to reach out and talk to others. They make us feel anxious in uncertain situations. So it's like the illness itself keeps us ill.
Yes, absolutely. Absolutely.
So what broke it open for you this time? What was the trigger to finally get more help or to start to recover again?
So this last episode was, I was separating from my second husband. This separation wasn't going very well. And there was an incident of terrifying domestic violence from him, and that just pushed me over the edge. And I ended up with PTSD, but the thing is that I was not diagnosed with PTSD for about 5 years. So the anxiety and the depression that I was already experiencing, that was triggered by the separation, because I could see that, that's why it happened the first time I was separating. It had been triggered. This separation triggered it even more so. And with this, and with the incident on the balcony, it just, pushed me completely over the edge. And it was fast. It was really fast. And it was not just, the symptoms of the crying and the lethargy and the pain. It was the pain. It was the emotional pain. I had never experienced anything like this. This was a brand new symptom. I was living this pain. Sometimes it was so bad that I couldn't breathe. I lost weight. I couldn't work. I worked for a couple of months after that, and then that was it. I just couldn't. I wasn't able to work, and I couldn't process any kind of information. I could be in a meeting, and I knew I was in a meeting, but I didn't know what was being talked about in that meeting.
Right. And how did your employer at the time react to that?
Well, basically, they're saying, you got to pull up. Right. You're not doing very well.
Right. Did they offer you any kind of support in doing that, or it was just kind of a suck it up?
Well, I did that whole employee assistance thing, but that's 6 sessions, I think it was, with a counselor. I went on to short-term disability after the incident, and then I applied for long-term disability, but they said, no, you're not qualified. Or you're not, it was crazy anyway. And the thing is that when you're sick, you can't fight. You can't advocate for yourself. You accept anything anybody tells you. And I think that's one of the biggest, worst things for anybody that's in a depression. When they need help, they need support, they need, the understanding of people, and they're saying, please. And then you get corporations, you get insurance companies, they're saying no. And when they say no, you're cowed. You're completely cowed. You're cowering in a corner saying, okay, no, and you're terrified. You're terrified of the world out there.
Natasha speaks of access to help, care, treatment. It can be a very real hurdle in the road to recovery from mental illness. And that only fuels the problems for those looking for help. Dr. Jennifer Swainson is a general adult psychiatrist in Edmonton, Alberta. Dr. Swainson sees the system at work firsthand, and she knows the frustrations.
How often do you and the patient know what you need to do, but then get hamstrung by things that are outside of both of your control?
All the time.
What does that look like? How so?
Well, there's always challenges in medication coverage, right? People that, they may not have drug coverage and have to pay for meds out of pocket. That's always a challenge. And, certainly there are a lot of companies that offer compassionate coverage and ways for us to access medications for these people. But it's definitely a challenge when people have varying levels of ability to access medications. But also, the bigger piece is, I think, in relation to therapy. I think you had alluded to it earlier, but, most people, it's very challenging for them to pay $200 an hour to see a private therapist. There's therapists within the public system, but they all have sort of varying backgrounds and, varying availabilities. And a lot of times these programs, because so many people need them, have limitations that they can only see somebody once a month or once every 2 weeks. And there's a limited number of sessions. And in reality, that's not enough for a lot of people. There's also a lot of group therapy programs that have long wait lists. It's hard to get people into them, difficult to access. And so it is a very difficult system to navigate, for my patients, but I think also myself and my colleagues, it's something that we sort of look at day to day and really try to look at advocating for change, but it's a struggle.
How can, just as a follow-up on that, how can I'll ask you about both workplaces and the public system. So starting with workplaces, how can companies improve the mental health for their employees, or how can they help employees who are struggling to support them better? How can companies do that?
Mm-hmm. Well, I think if companies are flexible, with work accommodations when needed. I've had a couple of patients that work for some very supportive employers that have allowed them to work from home at times when they've been struggling. Something even as simple as not having a 2-hour commute, each day is a big stress relief, and someone's productivity can increase. I think being responsive to workload concerns and things like that with employees. It's sort of the story everywhere, right? Everyone's busy. Everyone's got too much work. And it's very challenging.
What about in terms of benefits provision for their employees? I mean, some companies don't provide any benefits at all. Others, as you've mentioned, might provide a couple of sessions of psychotherapy or limited medication coverage. What do you think that ideally should look like? What should companies be doing?
I think if companies had fairly comprehensive medication coverage, that would really help. Because certainly if someone's sick enough that they need to go on a medication and they're working, it's in that company's best interest to, have their employee gain access to whatever medication might help them get better the fastest. It can prevent disability, it can increase productivity. So I think the very comprehensive medication coverage is one. But also coverage for individual therapy. A lot of companies have their own employee assistance plans that people can access somebody over the phone, but full coverage for actually seeing a therapist of that person's choice would be helpful.
Natasha, like many people in Canada, is thankful our public system, for all its challenges, was able to provide the support that she needed when she needed it most.
Well, actually, it was OHIP. It was all covered by OHIP. So
public insurance, yeah.
Yeah. So the psychiatrists I had, they're covered by OHIP. And because I had been so ill, it wasn't a short-term fix. I had to be seeing them for quite a number of years. Mm-hmm. And then the trauma therapy program at Women's College, that was covered by OHIP. So OHIP, I've been blessed that I've been able to access it and use it. Otherwise, not working, I was not able to work for 8 years. I was that ill. And so when you can't work for 8 years and you're in the middle of your earning cycle of life, you can kind of come down to the bare bones of existence by selling every asset you have, kind of thing. Yeah. So OHIP really was there for me, and I'm really, really grateful to it.
That's great. So what do you do now that gives you, and I think we'll leave it here, what do you do now that gives you energy and passion? How do you channel this now?
Well, I've become a mental health advocate. I do public speaking with the United Way during their campaign and other events. And I'm just trying to get people to understand what mental illness is, what depression is, that it's really important that you talk about it. You don't hide it. You don't feel ashamed. You don't hide in the bathroom stall at work crying the way I was doing, because I was ashamed of how I was feeling. The feeling emotional and feeling that when you are emotional, that's actually a normal thing to be doing. And that if you are feeling bad emotion, then you'd find out why you're feeling that bad emotion. So I just want people to know that, hey, if you're not feeling good today, tell your friend, I'm not feeling good today. Don't hide it. We have to stop hiding, how we feel. I think that's one of the key things. We have to say, I'm not having a good day today. I just need to take some time away from everybody and accept it. And when your friend says that to you, you say, okay, well, how can I help you? If you can't, well, then we'll talk tomorrow. and just be supportive. Be supportive to people.
You've been listening to a special episode of So-Called Normal with Mark Hennick. If you like what you heard, share the episode with others. You can always follow Mark on Twitter, Facebook, LinkedIn, YouTube, and Instagram at Mark Hennick. Otherwise, you might want to check out his website, markhennick.com. This special series of So-Called Normal has been produced by Mark Hennick and Eye Contact Productions. I'm Dave Trafford.
This episode of So-Called Normal is brought to you by an educational grant from Janssen, Inc. Mark Hennick and the producers of So-Called Normal are solely responsible for the content of the episode, and the views and opinions expressed in this episode do not necessarily represent the views or opinions of Janssen, Inc. The podcast content is provided for informational purposes only and is not intended as medical advice. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, product, or treatment. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in this podcast episode.